There is an estimated 581,500 new job openings expected in the near future for the nursing profession, and this is only expected to rise. This is among the largest number of any occupation. From 2008 to 2018, employment of RNs is expected to increase by 22%, and this is for several reasons, including medical advances, the aging of baby boomers, which they're living longer and therefore needing more medical care as they age, and also as nurses retire, they're needing new ones to take their place. I began my nursing career in 1996 as an LPN and then received my RN degree in 2006. After this speech, I want my audience to know the difference between an LPN, an associate's degree RN, and a bachelor's degree RN, all of which are nurses but play different roles in the nursing profession. I will discuss differences in their training, their job opportunities, and their salary, as well as the ministry that their jobs open. The first nurse is an LPN, or licensed practical nurse. This degree takes approximately 1 year to complete, plus they must pass their state boards of nursing. Most degrees are sought through a vocational school or technical center. Half of the school is classroom and half of the school is clinical. Once graduated, most of these nurses find jobs in nursing homes, doctor's offices, home health, or some smaller hospitals. LPNs are taught hands-on bedside nursing, most like the old diploma school nurses. Some states are trying to get rid of LPNs, but so far this is not helping. As an LPN, you can expect to make $10 to $13 an hour as a new grad. The nursing homes normally pay more as they do not use RNs any more than they have to, and the LPNs are throughout the facilities. The hospitals normally pay an LPN the least and use the LPNs the least. The next type of nurse is an associate's degree RN, which takes 2 to 3 years to complete, plus they must pass the RN boards of their state. This is usually done through a state university, and this is also the degree that an LPN will get if she bridges over from an LPN to an RN. The only difference between this degree and an LPN degree is that they are going more to some management and getting some more training through of the management side of nursing. They still focus in on patient care. These RNs are used in hospitals mainly, but jobs are also available in home health, travel companies, nursing homes, insurance companies, and some other places. Salaries range from $17 and up, depending on where the nurse works and if they are in a specialty area, as some places give you money for your LPN years. The other type of nurse is a bachelor's degree RN, which is a 4-year degree and is normally gotten from a university. These nurses are mainly trained in management. That's the biggest difference between an associate's degree and a bachelor's degree. You're still trained with all the nursing, but you have more management experience. Many companies want a bachelor's degree nurse just to say bachelor's degree nurse. The training is the same, except with the bachelor's degree they focus more on management and less on patient care. Therefore, when these nurses come out of school, they have less clinical training than either of the other two and less hands-on experience. Jobs for a bachelor's RN will be in hospitals, research facilities, insurance companies, drug companies, teaching, anywhere that a nurse is used. The salary for a new grad bachelor RN will be $20 and up, depending on where she goes to work and what part of the country. All of these nurses do the same fundamental job. Nursing is an occupation of caring for people. We are caring for their mental, spiritual, and emotional needs, as well as their physical bodies. Nurses do a lot of teaching and caring not only for the patient, but also for their families and or caregivers. What their degree is will determine what the role she plays in the classification of duties. In reality, though, all nurses do the same job, with very few differences, and most of these depend on the specific workplace. All nurses have a multitude of opportunities to witness in their workplace with each patient. The love and respect we show these patients is the greatest expression of God's love that we can show. We see these patients at their most vulnerable. Ministering to their needs during this time with compassion and genuine care is the greatest show of God's love that anyone can show. In conclusion, nurses are an irreplaceable part of the medical team, no matter what their degree. God has commanded us to love, encourage, and help one another. There is no other profession that allows you to do all these things while providing care to the body, soul, and mind. I hope this speech has helped clarify the difference between an LPN, an associate's degree RN, and a bachelor's RN. Thank you.